Well, I want to thank all of the speakers for their very insightful presentations and discussions. I had seen the slides ahead of time, but I got an enormous amount of information from the presentations here. So we have a lot of questions here. So while I'm going to start off with one and then look through some of these to hope we can get through most of them. There was some talk, I think, Richard, you talked a little bit about some of the unintended consequences. And I was just wondering if maybe the three of you could think about, as we talk about either reductions in marketing toward children or advertising toward children, or we talk about product reformulation, partnerships, whatever the strategies might be, whether there's some unintended consequences of these strategies that we need to be aware of and be thinking about. So, Jennifer, do you want to start off on that?
Sure. Well, I can talk about a couple specific examples. One is with the Children's Food and Beverage Advertising Initiative. The focus was on advertising to children up to age 11. And what we saw after that program was implemented was that advertising to 12 to 17-year-olds shot way up. So it was, a case of reducing for one group but increasing for another. I'd also say, I may be not popular if I say this, but I also think there are unintended consequences of some of the Healthy Kids Meal initiatives, because what we're seeing is that fewer parents are buying kids' meals for their children. A lot of parents are going to the dollar menu or the low price menu instead, and I think the more, kids' meals aren't great, but at least there are fewer calories than the regular meals, and the more restrictions we place on that, I'm afraid we may be pushing parents to the cheaper but less and nutritious, higher calorie other options on the menu.
Sure, yeah. There we go. Yeah, unintended consequences are something we really try to map out, as much as we can, and clearly sometimes we're not able to really think about every single element of it. The one thing that I think is a challenge and will continue to be with the beverage companies and the restaurants is that these organizations are always listening to their customer. And so when they hear something from the customer, that's their DNA, right, is to really react to what the customer wants. And so I think that there's something there that we may not know really from a behavior perspective exactly what moms, for instance, if we've asked them to go into the stores and look for something different on the shelves, one of the things that we're learning in East LA is a lot of the things that are happening in the homes. And so we learned yesterday that a lot of the decisions are made and a lot of the foods that are and drinks that are being served are in the homes, and there's definitely homemade drinks too. So again, those are the kinds of things that we're thinking about. We may not know exactly what the ramifications are, but keeping our eyes wide open about those things, just as Jennifer said, is really important. The one thing that we built into the beverage agreement this time is that this definition of liquid refreshment beverages includes 100% juice, because one of the things we saw in the early days is that in the reduction of soda and the communicating that juice was better, we then obviously have a problem now with too much juice, 100% juice consumption, as we talked about yesterday too. So really important question to ask.
So one point from an industry perspective, just on clarity of language, you mentioned customers, and people think of customers as the folks that buy the product, moms, dads, whomever. From the industry perspective, the customer is actually the retailer. That's who the industry sells to, is the retailer. And then the consumer is the person that buys the product off the shelf. So if you hear people talking about it, they actually make that distinction. But getting back to the question about unintended consequences, I'm actually going to go back to the taxes, but now talk about the Philadelphia tax. And I think you'll find most food and beverage companies are keen on a level playing field. And so if there's a tax out there, fair enough, you can deal with it. I think the unintended consequences of a tax that went across all beverages in Philadelphia, sweetened beverages, is that it fails to take the opportunity to incentivize change. Incentivize change on the part of the consumer or incentivize change on the part of the industry. And the unintended consequence might be that there's no distinction. I have no idea how it's going to play out. Has anybody got data on that yet, do you know, on Philadelphia? Or is it too soon? Too soon. Yeah, it's going to be really interesting to see if there's any significant shift in consumption. I understand that the value of the tax, the revenue source, and all the rest, not arguing against that, but just I think it could have been, while trying to make it simple and easy to implement, you may actually fail to maximize the opportunity for behavior change. And that's just, they would never have expected that, I don't think. But we'll see. I'll be keen to see that.
Thank you. There's quite a few questions here that I'm going to combine into maybe a two-part question. These are related to either differences by race and ethnicity or socioeconomic status. So the two-part question is, are there differences of the effects of marketing? Do we have any information on the effects of marketing itself to parents based on their race and ethnicity or socioeconomic status? And then the second part of this question is, what ways have the efforts contributed to decrease marketing or affect marketing, change marketing to different subgroups of the population? So the efforts that have been implemented to either reduce marketing, have they been applied generally across the population, or are they specific to certain subgroups of the population? Okay. Jennifer?
Okay, two great questions. For the first one, has there been research on difference in effects on different audiences? And there hasn't been a lot of research. There's a lot of hypotheses that actually we're working on testing some of these now. One is that because the world of advertising presents an image of a world that is aspirational for lower income or recent immigrants, this is how Americans live, there is a concern that the advertising might be more effective or might affect those audiences more. Now, that hasn't been tested. We're looking right now at targeted marketing to adolescents and looking to see if and then the other issue is targeted marketing. So for disadvantaged populations who haven't traditionally ever seen people who look like them in the advertising, the targeted marketing to Black or Hispanic audiences could be more effective. And our research with adolescents is showing that they really like those ads. And even when you point out to them that these are products that are not healthy, that are not good for them, it still creates a lot of goodwill in these communities. I think we're going to see more of that. In terms of how changes have affected different audiences, one thing that we're seeing is that exposure to advertising, especially on television, is going way down for white youth, especially white teens, but it's staying flat for Black youth. So a lot of the newer ways, Hulu and all of those kinds of things, online viewing is reducing TV exposure for, I would guess, white middle class, upper class kids more than others. And so the disparities in exposure between Black and white youth are growing. So anything that we do to reduce or improve marketing to youth is going to benefit Black and lower income youth more. So that's how we like to see it. Now, I haven't seen the data for parents, so I'm not sure if, I'm guessing the same sort of patterns would hold there.
Okay, thank you. Anybody else? Good. I think this question may be directed more toward Richard, but everybody should feel free to, if they have input on it. I think this is related to your point about the internet and social media and all of that. So the question is, are there specific success stories of how they say here technology, but I'm going to broaden it to include the social media, is used to improve food and beverage consumption, especially in race and ethnic groups or low-income areas. But I think the broader question is, do we have information on how it could be used effectively?
Right. So what I should have said as well when I went through that is that accessing social media in particular, but the internet broadly speaking, digital technology is one of the tools, of course, in the toolkit for any company in their marketing campaigns. And it's one of the things that they go after. But your question really is, how do you leverage that? How do we leverage that in this community in order to affect change? There's an article that was just, I think, in the New York Times yesterday. I haven't read it, but I saw the headline, and it essentially directly asked that question, and it gives people a platform. And the example that I'll use, and I'll have to qualify it after I give you the example, was with regard to a campaign that was started by some young lady on Gatorade, and there was a component in Gatorade that I can't remember what the component was, but she had a real issue with it, and it was permitted for use in the States and maybe in Canada, but not in Europe. And I don't know, 3 months after she started a campaign, and it was a huge groundswell of support for getting this thing, whatever it was, out of Gatorade. And then 3 months later or 4 months later, PepsiCo makes the announcement, we're going to take this out of the Gatorade. Now the reality is, any major reformulation change that you make, you have to do a lot of product testing, you have to do shelf life testing, you have to do your supply chain work, and you can't do all that in 3 months. So, in fact, the company was certainly working on this, had to be, it was before I was there, had to have been working on it. Nonetheless, that campaign sped the rate or the pace at which the company responded. And so one person, because of the platform of the internet, can actually generate, provided that the topic really gets to the heart of the issue for people and makes it near and dear. Now, the flip of this is that you can have people going off on things that are not based in reality, or exaggerating things. And my thing about the DNA was an example. The other one I always joke about is that, did you know that, I don't know, pick any beverage you want, and that we now put fire extinguisher material in the beverages? And people go, you're kidding. Yep, it's like 95% water. But you get the point, right? They put fire extinguisher stuff in there? Yes, it's called water. And the way in which people twist things around like that, and we deal with the food babe, not the food babe does things negatively all the time. I don't follow her online. I have seen some of the things that have been posted. It's a real challenge. So those are examples of the way in which this has been leveraged to either speed up process or name and shame or to get people on board.
Yeah, I think Richard made an excellent point when he said that we need to do more to leverage social media and digital media generally. I think the food industry has been at the forefront of marketing through digital media, through social media, apps on mobile phones, and they're always going to outspend us. But I think one area where a clever viral campaign can really make a difference at a very low cost is through social media. So I don't know, if people knew how to create viral campaigns, we would definitely be doing it. But I think it's really something we can leverage more.
I'm just going to add to that. It is true that food companies, any industry has has more money than the individual in terms of marketing spend. But that's the beauty of the internet, is that you don't need money, you need creativity. And there's a lot of creativity out there. So you don't need as much money to launch something like that. You just need to be creative in the way in which you do it.
Okay, Anne, I have a question it's asked directly of you. I think you should answer this however you want to. It might be a little bit loaded. But anyway, it's the question of why we aren't seeing more federal support or funding as part of these partnerships. These partnerships seem to be between foundation and the industry. And is there a role for the federal government in supporting these?
That's a good question. I don't know the answer to that. I do think that there is a role for government too. I mean, one of the things that we have really been trying to do and are still in the very, very early stages is to figure out how to connect particularly with county public health departments on this work so that we are all using the same messages and the same campaigns. And it isn't a battle at the local level where we're asking families to choose sides of whether they want to pay attention to a company asking them to drink water or a public health department asking them to drink water. So there is a role for government. From a federal perspective, I really am not knowledgeable on specifically that. Richard, you may have some more insight into that.
A quick comment on that one. Many people might know the International Life Sciences Institute, ILSI, North America, and I was there for a number of years. Eric Henches is the executive director there now. Eric led an initiative with the USDA, John Finley, Pamela Stark-Reed, others, to develop the branded foods database. And people may be aware of this. It's now up and running. I'm going to guess it's populated with 200,000 branded foods now for the USDA database, which informs NHANES and everything else. The USDA database is roughly 9,000 foods. All of a sudden, 200,000. Now, the depth of analysis is not the same. It's the information on the nutrition facts panel, the ingredients line, allergens, net weight, that kind of thing, whatever you get off a package of food. But the point was, though, that in fact was a partnership with industry via a third party, fair enough, ILSI, and there's also a foundation within ATIP, that helps USDA out. But USDA partnered with the food industry through these other groups to generate this database. USDA owns the database, the food industry supplies the data, and it's accessible for free to all. There are instances like that, but it tends to be more on the research side as opposed to the outreach or consumer ed side. Mm-hmm. And I think that's just the nature of the structure of the granting systems that we have.
Right.
You probably have something to say about that.
Yeah, if I can.
Sure. We're gonna get a mic for you.
Because Bob knows a lot about this.
Yeah, on the partnership side, and definitely that's a perfect public-private partnership example, Richard. But the My Plate Strategic Partners effort and the Center for Nutrition Policy and Promotion is the perfect example of a cutting-edge agency that actually goes up and pushes the envelope. And there's more than 100 organizations from every sector that are actually part of that whole My Plate programming. And drink water instead of sugary drinks is one of the 7 messages that were out there as part of the My Plate release in 2011. It still continues to be that message. And so Drink Up and other companies associated with it and other companies continue to support that statement and programming with it as well. So there is efforts out there. I think a lot more needs to be done in terms of the measures for success.
Can I ask for clarity on that? Is it a partnership where both sides are contributing, say, funding to the initiative that then gets spent? Or is it a permission on the part of the government to use My Plate and an encouragement, in fact, to use My Plate and to support the use in communication efforts by member companies?
So it comes with like-minded agreement on, obviously, everything aligning with the Dietary Guidelines for Americans. It comes with funding from each side. So there's nothing that needs to cross. So
right.
If it's a different example, but one that's an instant one is, whole grains, pushing for more whole grains meant the members of the grain chain supporting video development, and the government came up with the ability to create the videos and the online talent that would be part of it. So it's that kind of partnership. So there's a lot of products and resources and tools that are there as well that contribute to this.
Thank you. That was a good back and forth. This is a question that person is directed it toward Jennifer, but again, I think it's something that all of you should feel free to address, which is it's a long question and it has different parts. I'm going to try to summarize it, which is as we might move toward the reduction of marketing or advertising of sugar-sweetened beverages, do we want to replace that advertising with other kinds of advertising of, for example, more nutrient-dense beverages and healthier food choices?
Well, that's a great question. And actually, lets me add one more unintended consequence that I wanted to talk about that I forgot to mention, which is that as the sugar is going down in the beverages, the artificial sweeteners or the non-nutritive sweeteners are being added. So I think that is definitely something that the nutrition community needs to weigh in on, and maybe more disclosure about what's in the products. But in terms of marketing healthier foods to children, you know, this is, when the IOM report came out, that was the recommendation, that companies use their creativity and resources to market healthier foods to children in place of the unhealthy food that is typically advertised. So this has been something that has been talked about for 10 years, and it hasn't happened. I mean, when we look at what is advertised on television and in other sources, it's used to be 94% unhealthy, now it's 86% unhealthy. So, you know, tiny improvements, but I'm not sure why that is. I think that really the healthier things, the things like fruits and vegetables and milk, do not have the margins that packaged processed food does, and that may be the reason. But there is also a sort of a philosophical thing to think about, which is, should children be advertised to at all? If it's really the parents' decision to determine what is served to their food, and if children's cognitive abilities really are not developed enough to understand the marketing, and we know about young children, but as marketing becomes more complex and disguised in many ways, it's becoming more difficult for older children to recognize that marketing too. So you know, I'm not going to tell you my opinion, but there is definitely a camp that believes that children should not be marketed to at all. It's not appropriate.
So I would take a somewhat different view. I would ask if a company was marketing apples, selling apples, I think that's a perfectly reasonable thing to advertise to a child. Fair enough, it's pretty clear. But if you accept that premise, then you can say, okay, there should be standards, and these are not industry-developed standards. These are broadly developed standards. That, you know, if you meet these standards, this is a kind of food that you should include in your diet. Not that it's permissible to include in your diet, but that you should seek to include in your diet, like fruits and veg, like Green Giant, right? But go ahead.
No, well, I would just say, but what if your child's allergic to apples, and now they can't have apples, and all the other kids have apples? I think
I'm allergic to apples, as it turns out, and I miss it terribly. It's true. People know me know this. But you can't. At that point, you can't say, well, that's clearly going to be something the parent will deal with, right? An allergy or something like that would be clearly something a parent could deal with. But there must be some foods that we would say, dietary guidelines make it clear, we need more of those in the diet. And in fact, we often argue, or people often argue, where's the money coming to advertise fruits and veg? Where's the money coming? Okay, so there's a set of criteria that you could develop around that concept, what fruits and veg are. And that could inform, and I know that was the interagency working group that Margot referred to yesterday. Now I'm going to jump over to something that Hank Cardello, many of you may know Hank, he mentioned once to me, and he's mentioned, I think, publicly as well, is this notion of, I don't know how it works from a tax perspective, but the advertising spend, your A&M is tax deductible, I think, at some level. Could the tax, I don't know what you say, the tax deduction be reduced for less healthy foods? So in fact, it's more expensive for the company to advertise those. And the tax deduction should be increased for the healthier versions. So there's an incentive to advertise those. whatever that, and it's not, the company hasn't said, well, we've decided this is healthy or not, but can you use those kind of market dynamics to help shift the ad spend? And I don't know if it's possible from a tax perspective or not, but that was something Hank had raised at some point some time ago. Last comment would be on the sweeteners. I looked it up at Peapod, and I use Peapod all the time because you get the ingredients, the nutrition facts panel right away. The Capri Suns and things, right, that you showed, and they had high-intensity sweeteners, zero-calorie sweeteners added in.
Some of them.
Yeah, some of them. They didn't have aspartame. And I don't know this to be true, but I'm willing to bet that you would not find aspartame in any children-targeted beverage because of this universal sense, and I don't subscribe to it because I'm perfectly okay with aspartame myself, but that it's a consumer choice thing. I don't want my child to have an aspartame sweetened product at all. If there are none that say aspartame, that says to me that the food industry and the beverage industry is aware that parents, in some instances, read the label of ingredients, and they might look for aspartame to say, that's a disqualifier for me. And that's often what people do. They look for the disqualifiers. Trans fat's a disqualifier. High fructose corn syrup is a disqualifier. That sort of thing. It's a smaller percentage, I know, and it's not universal, and consumer understanding of nutrition is woefully, woefully lacking, in my view, which is why I think a third-party vetting system is also an interesting way to go.
So Jennifer, I can tell you want to add something, so just a little bit on that, and then I'm going to move on to the next question.
Okay, yeah. I don't think parents probably know what aspartame is. They probably don't know what sucralose is or acesulfame.
Agree.
I don't even know how to pronounce some of these.
ACE-K,
So,
yep, agree.
So anyway.
Yes.
There's one question here about sort of measuring and tracking success. Now, Anne had quite a few slides in her presentation that were looking at different measures of success of these partnerships. I was just wondering if you could maybe expand a little bit. Do we want to look at changes in consumption of sugar-sweetened beverages as a success, or do we want to look at what's product reformulation? Do we want to look at what's being offered in different venues? I think it would be useful to, I think that actually might fit into the last session of the day too, which is the measures of success.
Yeah, I think all of that, right? I mean, if we really could, we would want to measure this at a lot of different levels and really understand what are the levers that are making the biggest impact. I think that when you look at, kind of the theory of change and the logic models around this work, we are making some leaps because we don't have the resources to evaluate some of these things and exactly, there's correlation but not causation potentially too. So what we do is not only really verify, I guess, that the companies are doing what they said they would do, but we also look for the evaluator to help us look at what impacts they have to the extent that that's possible. We, through some of our work with the Robert Johnson Foundation as an example, are also looking at those opportunities to do something that is much more related to the actual consumption and the change in behavior that we're really trying to achieve. So I think ideally it would be all of that, and we would have a lot more information to make these decisions on. Some of these are still a little bit of a leap based upon, general theories that we've all been working on for many years.
I would argue go for a very specific measure. In this case, I would say sugar consumption through beverages. That would include 100% juices, I know. Even orange juice, which maybe expands it too much, but it's very simple. And if we can show a continued downward trend in sugar consumption, sugar in the beverages, if you want to say added sugar is fair enough, then define it broadly. I think that, because we're buying, we understand the concept, we need to consume less sugar in beverages, less sugar, added sugar overall. That's a very straightforward measure. I think the timeline's too short to get to physiologic effect.
Okay, great. Here's another question that probably touches on these unintended consequences, that the overarching one at the beginning. And it's asking for the panel to talk about the use of juice concentrates in place of other sweeteners. Is this an approach, either through marketing or of the industry, to skirt the sugar-sweetened beverage issue by substituting these juice concentrates?
I've voiced this before, a fairly strong view on these things. If the juice concentrate has been what I refer to as stripped, meaning they've taken out any characterizing aspect. And so you might see in the ingredient line apple and or grape and or pear juice. And you think, how on earth can they do that? Unless they're all indistinguishable from one another. If they're indistinguishable, it's because all the characterizing aspects have been stripped. And if that's the case, fair bet that all the nutritive value has been stripped. Mm-hmm. So in my view, and this is my view only, if you reconstitute that, I'm sorry, you're reconstituting water and sugar, I believe. I don't have the data on this, but this is what it strikes me as being. So that's where I run into this, that I worry about that. I really worry about the strip juices. And therefore should be added sugars.
Yeah, and our work is really focused on all calories and all sugar for that reason as well. For that for many reasons, but to not have there be those unintended consequences of just swapping out one sweetener, one caloric sweetener for another.
And I don't have any nutrition training, so I'm not going to wade into the juice versus sugar. But that is definitely what is happening, and also in the drinks in schools as well. So,
Great. Okay. It's an interesting question here. I think it has to do with the definition of child-targeted marketing. And the question is, should we change that definition so that it's based on the raw number of children users, such as the example of Dance with the Stars, versus the proportion of viewers that are children?
okay, I'll take that one. And I'm looking at Tracy because she headed up an HER expert committee on redefining marketing to children, and that was a big topic of discussion in that. And I think one thing to understand is that there are children's programming. There is big things like Dancing with the Stars, the Super Bowl that has a lot of everyone watching. But there's a big chunk of marketing or big chunk of programming in between those two that aren't covered by the CFBAI that we recommended should be covered. So these are things like, it's a misnomer, but Adult Swim and Nick at Night are heavily, heavily watched by young children and young teenagers, not by adults. Those programs aren't covered. There are family programs like ABC Family Disney movies that are watched by children and their parents, so those aren't covered because there's a very specific 35% of the audience has to be children under 12 to be covered by the program. So those have, 20% children under 12 or 25% children under 12. So what we recommended was that first of all, that the CFBAI definition of children be extended to include up to 14, and also that those chunks of programming in between that are watched by young people, not adults, but young people, are covered. Now, when you start to get to programs like where a lot of adults are in the audience, then you run into First Amendment issues because you'd be restricting advertising to adults. But at least the voluntary measures should cover those in-between programs.
Yeah, and to the point directly of percentage of the population viewing or absolute numbers, I really don't know how you get around the big event television occurrences like the Super Bowl, like the World Series, like the Stanley Cup, where you just get a lot of people watching. Yeah. I don't know I just don't know how you'd address that.
Right.
And I've not been involved in those conversations.
But that's only about 25 or 30% of the ads that kids are seeing on those kinds of programming. So you can really extend the rules to cover a lot more of the ads that they're seeing than they do now.
And I can't speak to the, the advertising piece as a topic with any expertise, but I will point out that one of the reasons, of course, that Pepsi had a sugar-free Super Bowl ad campaign this last Super Bowl was because of this agreement that we have. And that, again, this is about getting out there with their marketing and advertising in a very, very different way than they ever did before, which is promising, and I think something for them to be commended for. And we're seeing that from all three of the companies.
Okay, another unintended consequence type of question. This is very specific, but I think it gets at the point, which is how much, so the Capri Sun ad that we saw that had 30 kcals listed, how much does that, which we might think is a good type that's it's only 30 kcal, how much does that lead to the increase in the consumption of full calorie Capri Sun? So that's very specific, as I said, but more generally, as we have reformulated products that may be more in line with what the recommendations are, does that have these unintended consequences of increasing the consumption of those other ones that aren't as healthy?
Well, I would say it does. I mean, if you, as I mentioned in the beginning, there's a brand manager who's responsible for profit across all products within their brand, and their goal is to increase all those product sales. And also, one of the recommendations that we made in the HER expert committee was that if a product is marketed on children's television, all the products within that brand should meet the nutrition standards that are set, because as you could see, the image of the Capri Sun fruit drink is not that different from the image of the other products that do meet the standards. We did a study looking at Lunchables where there were 4 products that met the nutrition standards for the CFBI, but out of 20, I think it was 27 in total, and the healthy ones were the ones at the top shelf in the store. So allowing the brands to be on children's television, I think they need to think of, they need to be responsible for all of how it's affecting all of their products within their brand, not just the specific product that is advertised that's shown in the ad.
Another way of looking at it is that in talking to the 3 companies that we're working with so intensively, it's actually the intention to do the opposite, where incrementally we can begin to introduce products that are lower in calories and then ultimately not have the higher calorie, higher sugar products selling as much, but switching out the products. And so it's, as opposed to, a gateway to more calories, it's meant to be moving in that opposite direction, which is something that I think we all need to encourage and watch for.
Okay. There's a question from the audience right here that somebody, I think, was specific to this point. So.
Hi, Sarah Balda from GW. I wonder, is it even possible in terms of parents and parental control, or has it been explored at all in selecting in terms of social media? I have 2 young children, and sort of trying to monitor their exposure through shows, through YouTube, through what have you, Netflix. Is it possible to have an intervention of sorts that would give parental control to exposure to ads? This may exist, this may not exist, but is there any way for me to pay, and again, that's an equity thing, but to pay to have my kids exposed only to content I choose, and my selection would include no ads as a parent?
Well,
DVR.
DVR and monitoring, tracking what sites they're going on the internet or on the computer and also on their mobile phones. But this is actually an interesting question because one point that was brought up yesterday was that children should only be exposed to high-quality media. There was no definition of what is high-quality media. I would argue non-commercial media is, in general, something that parents should be advised to look for. But but the other thing about digital marketing is that is a whole new ballgame. It didn't exist when you were a child, when today's parents were a child. So that a lot of parents don't even know that it exists, and they don't know what to look for. So just I think greater awareness of what's going on those in those media is important too.
Jennifer, could you clarify non-commercial media? What do you mean by that?
Well, for example, PBS shows or
But if you're talking internet.
internet.
Is there lots of
Yeah, I don't know.
non-commercial out there that I would go and say, whoa, on the internet?
Well, I think I don't. I actually can't think of any websites that don't accept banner advertising that are targeted to children. I think they all do.
Really?
Maybe something like Sesame Street or something, but and also in the apps. So downloading the games.
Yeah.
If it's free, then you're the product. I think is the.
I think the question was focused on television, right?
Is there a market? Is there a market for? Sorry. Is there a market for some type of app that? Because I recognize this. I've experienced it with my kids. They find YouTube, and I'm horrified to see on Peppa Pig something for Coca-Cola. So, is there a way for me to purchase an app that would allow me to block ads, screen essentially?
No idea.
I think there are such
I-
things, but I
think
don't know.
it's a really interesting question. I actually think it goes to the point. I mean, obviously, I don't think people know very much about it here, but it goes to the point that Richard made, which is we can't ignore this, the impact of the internet and what we can get on social media, and so I think it's something for really further consideration because I'm just not sure we know enough about that now. It looks like we have 41 seconds left. And I think actually that the questions I have left are pretty much building on some of the concepts we've already discussed. So what I'd like to do is just thank the speakers again, all three of you. I thought you did a fantastic job. It was a really good discussion. Oh, yes. One more question from the audience? Here. Sorry.
Hi, I'm Diane Welland with the Juice Products Association. I just wanted to say something about the juice concentrate when you were talking about as an added sugar. So in general, if a juice concentrate is reconstituted to the Brix level of 100% juice, it is not considered a sweetener. But if the juice concentrate is added to a product to sweeten and not reconstituted to its 100% level, then it would be considered a sweetener.
Right, and I have no
Sugar.
problem with full juice, like an orange juice concentrate that is orange juice. It's the stripped juices that I'm concerned about, the stripped juices, and they're done that for the reason. And whether they're reconstituted or not, in my view at least, it's just the stripped juice that I worry about as a base for other products. That's where my concern lies.
But the function, but if the juice concentrate functions as a sweetener, then it would be considered a sweetener.
Okay.
That's right.
Okay.
Yeah. So.
Okay. Again, I want to thank our three speakers, Jennifer, Richard, and Ann, and we now have a break, and we will reconvene at 10:20. Thanks for great.